All right, let's talk about fetal movement. So, fetal movement can actually be seen on ultrasound really early in pregnancy. We can see little embryo moving at 7 and 8 weeks gestation. But most of us are going to detect movement from the fetus around 16 to 20 weeks. And those first detectable movements are oftentimes called quickening. It's a term that's used less frequently nowadays, but I want to make sure that you heard of it before in case you come across it. So, those initial early movements oftentimes feel like butterflies in your belly, some bubbles popping. I always felt like it was the most gentle tap coming from inside my uterus. It was such a cool slash strange experience. People who have been pregnant before beyond 20 weeks typically feel fetal movement earlier than first time pregnant people, usually closer to the 16-week mark. If you have an anterior placenta, that's a placenta that's on the front of your uterus, you may feel movement slightly later. And know that the perception of movement can be very irregular before we get to kind of like the 24, 26-week mark. Some days baby will seem much more active, and others baby will seem less so. But much of the variation isn't actually in baby's movement, but our perception of baby's movement. And that's because on days that we are really busy, we may miss the really subtle feelings of fetal movement in these early days. And when we are slowed down and we are paying attention, it will be more obvious. This becomes less of the perception of movement becomes less variable as baby gets stronger. Their movements are, more powerful, and they get our attention. If you are concerned about the level of fetal movement that you're feeling, slow down. Spend some time being mindful of any sensations coming from your uterus. You can lay on your left side, you can sit down, get in a comfortable position, and just pay attention for a little bit. Because, again, fetal movement in the second trimester can be very subtle and easy to miss. Your provider may recommend you keeping track of fetal movement, but that typically doesn't occur until 28 weeks. In some higher risk patients, we'll start fetal movement tracking at 26 weeks, but that's pretty unusual. But don't worry, we're going to talk all about fetal movement in the third trimester, so don't worry about that just yet. And in the third trimester, I'm also going to be sharing my bedtime bonding ritual that I did with all of my babies as part of my kick counts. I did this fun ritual, and it's some of the best memories I have of pregnancy. And I didn't have the most enjoyable pregnancies, so this was something that I'm really excited to share with you when it's time for you to do fetal kick counts. All right, you are incredible. I will see you in the next video when you're ready.